Welcome to Let's Talk by the Congolese United Foundation. Today, we're breaking down sickle cell disease management and community resources with Dr. Chris Denton. Stay tuned for trusted, culturally responsive health insights.
Hello everyone, and welcome to our show, Let's Talk, a community education opportunity for the Congolese United Foundation. Today, we are pleased to speak with Dr. Denton, who will help us understand the importance of sickle cell disease. As we spoke last time, I promised I would come with an interesting topic today, and this topic is sickle cell. So, for today, thank you first, Dr. Denton, for giving us the opportunity to speak with you today. My name is Jean-Jacques, and I am one of the members of the Congolese United Foundation. It's my pleasure to have Dr. Denton today. So to begin, can you please introduce yourself, Dr. Denton, and tell us a little bit about your job and what you do with patients affected by sickle cell disease?
Absolutely. It's a pleasure to meet you all. My name is Dr. Chris Denton. I'm the medical director of the sickle cell program at Seattle Children's Hospital and Odessa Brown Children's Clinic. I'm also the medical director of hemoglobinopathies in general, which includes thalassemia. And with respect to sickle cell disease, I have a clinical role in treating patients with sickle cell who come to our clinic, both at Odessa Brown Children's Clinic and at Seattle Children's Hospital. I have the pleasure to meet families when they are referred to our clinic as newborns or later in life, and ideally I will have the opportunity to see them until they transition on to adult care. I have only been at Seattle Children's Hospital for about a year, but prior to that I did my training in hematology at Children's Hospital Los Angeles, and I was on faculty there as well, where I treated a number of patients with sickle cell disease. And I am from the Seattle area originally. I had some experiences in treating patients with sickle cell when I was a medical student and in residency that showed me that I wanted this to be the focus of my career. And I went to Los Angeles to further that training. And the goal was always to come back and lead this program if ever the opportunity arose. So I'm very happy to be here now.
Thank you so much. And the largest question, the most important question people ask, what is sickle cell disease? Because many people in our community have heard about the name sickle cell disease. In French, they call it drépanocytose, but many may not fully understand what it is. Can you please explain in simple terms so that people really from the community understand what is sickle cell disease and how it affects the body?
I'd be happy to, and I'll do the best I can. Sickle cell is an inherited condition that affects hemoglobin. Hemoglobin is the protein that's inside of our red blood cells that carries oxygen throughout our body. And what happens in sickle cell is that change in the genetics that makes our hemoglobin leads to a change in the way our red blood cells are shaped when that hemoglobin that normally carries oxygen delivers the oxygen to our tissues. And the shape change is from a very circular, squishy red blood cell that can travel nicely through the blood vessels, and it becomes this sickled shape. Some call it more of a crescent moon shape, but it's related to a sickle that is used to harvest wheat, for example. And that sickled shape is very rigid and sticky. So the two problems that happen in sickle cell is that you get breakage because the red blood cells are much more fragile. So you develop something called hemolytic anemia, which is when the red blood cells break down and you don't have as much hemoglobin as at baseline to carry oxygen throughout your body. And you get blockage because the red blood cells are in this sticky shape. They stick together and cause what's called vaso-occlusion, or blockage of the blood vessels. And that can cause a variety of problems that we'll talk about.
Thank you so much. Wow, this is fascinating. And sickle cell disease affects many families of African descent, including people from the Democratic Republic of Congo, Angola, and other African countries. Why is it especially important for our community to learn about this disease and condition?
I think this is a slide that we can show later if you'd like, but I wanted to show this map because you mentioned the Congo, so the Congo is here. And you mentioned Angola as well here. And this is a map showing the number of newborns who are born with sickle cell disease throughout the world, whereas a darker red shows a higher amount of newborns born with the disorder. So you can see that the Congo is actually an area where the highest number of newborns are born each year in the world. Next we have Nigeria, and then actually India is another country where a lot of sickle cell is seen. So as you can see, it's quite prevalent throughout Africa. It's prevalent in the United States and in Brazil as well. And there are actually 300,000 people born with sickle cell disease throughout the world. But a lot don't know that. And it's something to be aware of because fortunately there is very good treatment and even cure available.
Thank you. Wow. So what was you mentioned a little bit about it, but what's some of the symptoms and signs of sickle cell disease and how we can diagnose this condition in children and adults?
Certainly. This is a picture that I just want to show that shows a variety of the complications that can occur with sickle cell. Because as I mentioned, there's both breakage and blockage. And where that blockage occurs in blood vessels throughout the body leads to the different complications that might happen. The most common presentation for sickle cell is pain. It's the highest reason why a patient with sickle cell might seek care. Because you can imagine that if you have blockage of your blood vessels, that's an area of the body where suddenly you're not getting oxygen to your tissues, and that can feel just very bad. Patients describe it as a tearing, throbbing, very painful sensation that is very subjective. And so people who are treating someone with sickle cell really don't know the kind of pain they're feeling unless the patient tells them. And in higher income countries, newborn screening is available. So when a child is born, they get a blood test that evaluates for a number of different disorders, including sickle cell, that could have interventions early in life that will lead to important health changes. Unfortunately, that newborn screening is not available throughout the world, so many people are born not knowing that they have sickle cell.
Wow. Are there cases where family may not know they have carried, like you mentioned earlier, the sickle cell, what they call the sickle cell trait? Because I've heard people talking, you mentioned sickle cell trait, and not realize their child is sick. Can you explain a little bit more about this concept of sickle cell trait and how people may not know they have this gene in their body?
Absolutely. So, like I mentioned, sickle cell is an inherited disorder. It's related to our genes, and it's called a recessive disorder, which means that you need one gene from each parent that will give you the actual disorder of sickle cell. And if you inherit just one of those genes, that's considered sickle cell trait. Generally, sickle cell trait does not cause problems, although in some conditions of having a low oxygen environment, being under a very stressful situation, or perhaps under dehydration, a person with sickle cell trait could develop symptoms that look more like sickle cell disorder. But it is very common that we will be seeing a child who was identified to have sickle cell in newborn screening, and the parents were not aware that they had sickle cell trait. Another sort of more detailed concept is that you don't have to inherit two sickle cell genes to have sickle cell disease. It could be that you inherit a sickle cell gene and then you inherit another gene associated with a hemoglobinopathy, which is generally something else that affects the way that hemoglobin is made. And together that still gives you a picture of sickle cell disease.
Wow. This area can be confusing for many people. Can you explain the difference between, well, you just mentioned it, but many families want to know what help is available, because as you mentioned, these conditions, it's complicated to manage, and the care team can provide resources. What treatment options or medical support are available today for people living with sickle cell disease, especially here in King County and in Washington State?
And that's something I really want to highlight, is that thankfully there are treatments available. And this might be an interesting picture only to me as a hematologist, but what I'm showing here on your left is a blood sample of a patient with sickle cell. And what we see here under the microscope is a lot of red blood cells. Those are a lot of these little circles But what you see in between those red blood cells are more of these pieces of red blood cells. And you can see, if you look really closely, that some of them actually have that sickle shape. Other parts of those red blood cells are just pieces of red blood cells that have broken open. And on the right is actually a blood sample of a patient who was on a medication called hydroxyurea. Hydroxyurea is a medication that is also used for cancer treatment because one of its effects is to lower white blood cell counts. But it was found that hydroxyurea also changes the way that we make our hemoglobin. It makes our body make more of the fetal hemoglobin, which is the type of hemoglobin that's made while we're in the womb. And by increasing the amount of fetal hemoglobin, it decreases the amount of sickle hemoglobin, and that reduces complications overall. It is our most tried and true medication that we generally recommend for all patients with sickle cell disease, having 2 copies of the sickle cell gene. And we use it for other types of sickle cell as well, depending on their complications. Aside from hydroxyurea, there are other medications that tend to reduce symptoms. One of them is called glutamine. That is really just like a protein that if you take it, it reduces the effects of sickle cell and makes it so that the pain episodes are less common and less severe. Even hydration is very important because if you're drinking plenty of water and your blood flow is good, then the likelihood of your red blood cells getting stuck within those blood vessels is much lower. So those are some of the basic treatments that I do want to talk about.
Thank you so much. Living with sickle cell disease affects not only the patient, as you mentioned, but also the parents, caregiver, and the entire family, even the community. What resources are available to support family emotionally, medically, and socially here in King County and Washington State?
It's a great question. So internally, we actually have a full sickle cell team that's very multidisciplinary. We have a social worker, we have a psychologist, we have a cultural navigator, we have an outreach coordinator, and all of that team together helps identify medical problems that can be addressed from a hematologist perspective like myself, but also recognizing that the social construct of the family and their environment can also affect the presentation of sickle cell. So we do recognize that the family is really important in ensuring that a family has a good community to support them. Outside of our clinical team, we also have the Metropolitan Seattle Sickle Cell Task Force, which is a community organization that helps families and patients come together, that also arranges health and wellness events and fun and fundraising events throughout the year. So we do try to keep families connected between each other and recognize that you're not alone.
That's good to know. And in many of our community, there is sometimes fear, stigma, or misunderstanding around health conditions, especially sickle cell. So what are some of the common myths about sickle cell you have heard and you have tried to correct in our community so people know exactly this is not true and this is the reality?
I appreciate you asking that. I actually want to flash back a little bit in these slides here because one thing that has been talked about is that sickle cell is a curse. And it's actually known that sickle cell trait offered a protective effect against malaria. So this is another picture of a sickle cell. This is an area of the world, as we know, where sickle cell is very prominent. And it matches another map that shows where malaria is most prominent, because having sickle cell trait actually gave a protective effect against having malaria. So those people who had sickle cell trait were able to pass along sickle cell trait, and it gave kind of a survival advantage from a natural selection point of view. So it was advantageous to have sickle cell trait. Unfortunately, having 2 copies of the sickle cell gene creates the disorder. So that's one point I want to make, is that it's not a curse. Initially, it was something that actually helped the person. The other side of it is that no one is to blame. I think families have been really upset about, who passed the sickle cell gene, how did this happen, thinking about families not wanting to allow marriages between 2 people who have sickle cell trait. And I really want to get rid of that fear, because I think even if you have a child or are living with sickle cell disorder, it is possible to get care, and it is even possible to have cure. And I think a person can still live a very full life even if they have sickle cell disorder.
Thank you so much. And my last question to you, what message would you like to share directly to our Congolese community, Angolan community, and the rest of the African community about sickle cell disease, especially about early awareness and the importance of seeking care?
One thing that's really changed the way that we manage sickle cell and has really improved survival is actually identifying sickle cell in newborns, because unfortunately, having sickle cell can put you at higher risk of infection. And so one of the first things that we do is we start a patient on penicillin prophylaxis that will protect them from infections that they are at higher risk of just having sickle cell. And beyond that, I think what I really want people to know is that you're not alone. Like I mentioned, I don't want you to feel like this is something that you need to hide, because there are treatments available, there are cures available. But if we don't know that you're out there, we're not able to help you. And we would love for you to come to us, come to the Sickle Cell Task Force, come to the Fred Hutch, where adult care for sickle cell happens, and ensure that you get the best care available.
Thank you so much, Dr. Denton, for sharing your knowledge and for helping us better understand sickle cell disease and also how to seek services and support for our community. So for everyone watching, stay tuned. More to come. As always, Congolese United Foundation is here for you and support you. We are a partner and we invest in your health. Thank you for watching.
Thanks for having me.